treatment progression with nasoalveolar molding ring plate comprises ring activation, palatal plate adjustment, and nasal stent activation. Ring activation is accomplished after every week. Palatal plate adjustment is done after every 2 weeks on fortnightly basis. Nasal stents that are fabricated on third week of molding therapy. Activation of nasal stents is on weekly basis. NAM therapy or nasoalveolar molding therapy is most successful during first 2-3 months after birth. Best time is within the first week after birth. Neonatal levels of maternal estrogens are reported to be highest immediately after birth. As per literature, the estrogen level gradually falls during the first month and then completely falls till the end of third month. Malleability or plasticity of the cartilage and soft tissue increases with the increased level of estrogen. Matthew Harris and Tenomo reported that high degree of malleability in neonatal cartilage is due to high levels of hyaluronic acid, a component of proteoglycans intercellular matrix. NAM therapy utilizes this initial period of 3 months after birth, taking advantage of flexibility of newborn's cartilage and soft tissues and its ability to maintain correction on permanent basis. Ring activation is done by adding 1 to 1.5 mm of self-cure acrylic along the inner surface of the ring and then dipping it in water to minimize smell of the monomer. The appliance is then inserted immediately in baby's mouth while the acrylic is still soft towards doughy stage. Petroleum jelly must be applied on the premaxillary segment and lateral lip segments before insertion. Parents are already guided for gel application. For rotation correction, further increment of acrylic is added to derotate premaxilla. The plate is kept in position, molding the soft acrylic with fingers along the edges of the ring. The appliance is then removed and immersed in hot water. The ring is then finished by removing acrylic along the outer surface with TC bar, maintaining its original thickness. Finishing is also done along the upper and lower edge of the ring in order to facilitate retraction of the premaxilla. 2 mm of acrylic is removed from the anterior margin of the palatal plate, encircled by the acrylic ring. The appliance is then finished with finishing TC bars, finishing stones, and finally polished with polishing buff. The palatal plate adjustment. The palatal plate needs adjustment on fortnightly basis to follow growth of the maxilla and for proper fit of the appliance. The self-cure acrylic is added along lateral borders or periphery of the palatal plate. Any soft acrylic sticking to the upper surface of the palatal plate must be removed before adding self-cure acrylic, otherwise polymerization of the hard acrylic will be disturbed. Petroleum jelly is applied on both lateral cleft alveolar segments, buccal mucosa, and both lateral lip segments. The plate is inserted after dipping in water with soft gel like acrylic. The baby is kept in forward posture, head bending down. The plate is kept in position for 1 to 2 minutes. Then the plate is removed and dipped in hot water. Finishing is done by removing acrylic along the outer surface, maintaining uniform thickness of the palatal plate, followed by polishing. Nasal stent fabrication and activation. The wire nasal stents are added to the ring plate on third week of molding therapy. The wire stents are bent from 0.7 mm stainless steel wire in the form of a spring that terminates in a helical loop. The lower retentive end of the spring is bent in an undulated manner for retention and is embedded in acrylic ring on both sides at its junction with the anterior margin of the palatal plate. Length of the stent wire is measured on baby's face as anthropometric measurement with the soft vinyl scale from upper margin of the ring to underneath the nasal tip. In this case, the measurement was 15 mm. The nasal stent on each side is fabricated on the terminal loop from self-cure acrylic, pink in color, with rotating movements of the hand. Finally, this acrylic stent bulb is covered with soft acrylic for baby's comfort, applying the same movements. The wire nasal stent is adjustable to place the acrylic bulb underneath the nasal tip with bird beak plier or 139 pliers. rounding of sharp margins of the soft acrylic filling the cleft gap for retention is done with red hot spoon end of the wax knife. This is to prevent irritation of the soft tissues on insertion of the ring plate. Sharp margins of the soft acrylic result from acrylic removal along the interior margin of the palatal plate during ring activation and may also be seen along posterior and lateral borders while working with the bud during palatal plate adjustment. The sharp margins must be identified by moving finger all around. The nasal stents are activated on weekly basis by bending the wire if needed and placing the acrylic bulb stent underneath the nasal tip, and also by incremental addition of acrylic onto the bulb when needed. The nasal stents on activation induce tissue expansion force utilizing malleability of the neonate cartilage and soft tissues. That force leads to advancement of the major alar cartilages to nasal tip projection. Incremental addition of the bulb elevates nasal dome on both sides, restoring nostril anatomy, and contours lateral crest of the major alar cartilages into convex form, which were flared at birth.